When I think about my brothers, my sister, I have 10 siblings, then what made the difference for each of our outcomes was, were we connected with people who surrounded us?
I knew the system was definitely broken when it took so much for me to get back into the system at 15, to the extreme point that I literally had to tape a tape recorder to my chest to record the abuse that was going on for people to believe me. And when I got back into the system, I thought it was the end of that storm, but it was just the beginning of the next storm. Being in the foster care system is such a roller coaster of experiences. When you think about, how do you fit into a family? How is it that you actually really truly start to feel like you belong after having the experience of having your stuff put in a trash bag and sent to the next family, right? And so I think the transition is always hard for any child, but I think during my teenage years, it was harder until I started to accept that I wasn't going to be adopted. I wasn't going to find, biological family and live with them. Today, in many states, if you're a grandmother or uncle or aunt who take in a relative, you get no type of support. But if you are in foster care, that foster parent gets an average of $800 a month, in addition to health care for the child and so many other things. And so I think, one thing that we could be doing as a country is supporting those relatives who take in a family member and making sure that they have those same type of resources to help a child heal, develop, and thrive. And my life would have looked better by having those type of supports that would have enabled some family members to step up. I started this journey of how do you support young people who are aging out of the foster care system? Over the years, what we realized is that the more that we listened, we realized that there were different parts of the system that actually have to be re-architected, that there are parts of the system that just don't work the way they are because they were never meant to actually help a young person heal, develop, or really be positioned to thrive. It was meant to mitigate the risk of abuse. So what we do at Think of Us is that we listen very hard to the stories, the nuances of people's stories. We conduct qualitative research. We look at data from across the sector, and then we bring those learning insights back to the federal government, to the White House, to the federal agency, and to Congress to say, hey, here's what we're directly hearing from people with lived experience and what needs to be able to change. We look at the hardest problems in child welfare and we run towards them. And then we turn around, apply technology, apply data, figure out how to make, efficient workflows and so forth. And then we try to invent a new type of program that will go ahead and solve that issue. Running a warm line, which is like a hotline, you just need partners who are willing to test different things like text message, mental health coaching, because we're living in a different age where some of the interventions don't work as well or are not as appealing to the young people that we serve. In the spring, we're anticipating that Congress is actually going to be looking at how do you reform the older youth services for those who are in foster care. And so we're truly excited about what that means. There's a lot of people gearing up. There's been hundreds of young people across the entire country who have been submitting their ideas and working on what that should look like. And so we're so excited about what this moment in time is going to mean for every young person. And these services are about being connected to school, to work, to being able to go ahead and heal.